Hello, I'm Jerry McIntosh, and this is Let's Talk COVID. And we're talking the next step in COVID. We worked on Mr. Derek Scott to come on as well. But first, we go to Carol McIntosh, who is a former educated administrative principal and now the president of Progressive Black Women. Carol, we're going to, I guess, get right into it.
Well, I'm glad everyone is tuning in to see Let's Talk COVID, our next steps. You know, now everybody has taken off their masks. They've lowered the social distancing guidelines. And so you see people just everywhere. And so we have the show just to keep you informed of what's going on with COVID and to also let you know that the virus around. It hasn't gone anywhere yet. It's just laying a little dormant. But we want to keep you updated on what's happening. And before we get into that, Jerry, I know Derek is on his way on to Zoom now. Can you talk about our sponsors?
Yeah, let me talk about our sponsor. We want to thank our sponsor, City of Pensacola, along with Mayor Grover Washington. Stay Safe Pensacola, Move for Change. Our partners, which is WBQP TV, WRNE 980 AM radio, along with Choice 106.1. We want to thank some of our other partners with Caring Heart, with Fannie Finken, who do help us with and get the food trucks and all of that, and also the health department who supply us the home COVID testing kits. We want to thank all of those individuals. We want to thank Derek for his work with the White House Task Force. He is here now with us in caucus.
Okay,
Derek Scott.
Thanks, Derek. Derek, it's good to see you.
Yeah.
Likewise. Good evening, everyone.
Yeah, we're back on again talking about COVID and trying to let the people in the community know how important it is to keep abreast of what's going on. And I know they're tired of hearing about it, but it won't hurt to listen and find out what's going on and get the latest news. So with that, I've got some things that I did a little research today and I found out a couple of things, but I want to get right into being on the task force. Can you share some updates with us? And while you're sharing those updates, make sure you talk about test to treat, because that's the latest thing now.
Yeah, I will say, number one, the first thing that is interesting to know that within the short week, if you recall, there have been, for the majority of the U.S., we've seen a decline in the number of hospitalizations and fatalities as it relates to COVID-19 from the original strain all the way up through our newest identified strain of BA2. There are 4 states that have been experiencing an uptake, and as of last week, Florida was admitted to that list of states that are seeing an uptake. Within a week, we have surpassed the state. So we have gone from number 4 to number 3 in terms of the states with the highest uptake in COVID-19 hospitalizations, fatalities, and cases that have been reported. So I want to make sure that everybody's aware that this is not going away, and I want to make sure that everybody's aware that you need to maintain all your COVID protocols. I know you've seen a lot of guidance around the CDC lifting their bans on whether or not you have to quarantine for 5 days, things of that nature. I just want to make sure that we're all aware. It's still on the take. Florida's still on the rise, and so practice the social distancing. Please make sure you get your vaccines. If you've only gotten 1 shot, make sure that you schedule time for your healthcare provider, your health department, to get the second dose. And if you've gotten both, make sure you get your vaccinations. If you find yourself experiencing symptoms and you are within a 5-day window of those symptoms. As Ms. McIntosh alluded to, the administration, our U.S. administration under President Biden, has rolled out the National COVID-19 Preparedness Plan. And in that plan, they talk about, you heard Ms. McIntosh reference test to treat. If you are experiencing symptoms, you can go to any your local emergency room, your home health, your provider. If you have at-home test kits, you can test yourself. If you find that any of those outlets, you find yourself in a positive test situation, you can go to the pharmacy, you can go to your healthcare provider, and they will immediately start you on a 5-day regimen on a oral pill treatment called Paxlovid. It is manufactured by Pfizer, and what that does is you're on a 5-day regimen, and by the end of that 5 days, you should get back to, at the next time that you test, to a negative status, and it will also help and mitigate and reduce some of the risks. Some of the side effects and the symptoms of the COVID-19 virus that many have already experienced. So just please make sure that you're doing so, wearing your mask. That's KN95 or N95 mask. If you don't have them, double up on the cloth mask or the green, I call them the green doctor mask that everybody has. Just make sure you're doing everything that you can. And please, please, please make sure that you're testing where you have appropriate at-home test kits. You can still order them at covidtest.gov or 1-800-232-0233. And you can get 4 test kits. If you are on Medicaid, Medicare, starting this month, you should be able to order up to 8 test kits per month on if you are on Medicaid or Medicare. And there's also an option for you to go on the website and use your private insurance. They can tell you how to seek reimbursement if you are have private insurance and you want to seek reimbursement for your at-home test kits. So those are some of the things that we are experiencing. I don't know if Mr. and Ms. McIntosh, if you got a chance to see the press conference this week that President Biden held on COVID-19 and the efforts, but it was really good. And, everybody, we're talking about maintaining our social distancing. The war on COVID is not yet over. President Biden is still, and his administration is doing a great job at making sure that U.S. is as knowledgeable as possible. But we still have a long ways to go.
Yeah, I thank you for sending that to us, because I did get a chance to look at it, and it was very, very interesting, Derek. But can you tell me you said there were 4 states that were arising with COVID. But can you tell me number 1, number 2, and number 4?
So number 1, yes, number 1 is California, 2 is Texas, and 4 is Hawaii.
And would you know why, I have an idea why in those 4 states COVID is on the rise?
I don't. Well, I hate to say that.
Same thing.
Yeah, I hate to say, Texas is what it is. I mean, I don't know why there's an uptick. Of course, California and those are, of course, they're the largest states in the nation, but why specifically, they haven't given an account or attributing to what is the rationale behind what's the uptick. I'm sorry, I said 4 is Hawaii. I meant 4 is West Virginia. I apologize. Yeah. I'm not sure what the rationale is, or what they're saying the reasoning is why they're experiencing a huge surge. I think it's because of the lack of the rules of the COVID-19 guidance and the CDC guidance. I encourage everybody to go to cdc.gov. If you're not clear on what the CDC guidelines are for the most effective way to prevent the spread of COVID-19, go to the website, and it will highlight everything for you. And in fact, there's a drill down. You can go to see if you're a person that has pre-existing conditions. What are the guidelines for those? If you are a person that are like you and myself, who are communities of color and Black and brown communities, there is a whole CDC guidance as far as COVID-19 as it relates to our community. If you are part of the aged population, aged being 65 years or over, there's a whole guidance of what those CDC guidelines recommend for you. And if you fall or in a crossover or a hybrid of one or more of those other categories, there's a whole guidance for you on those as well. And I continue to say, for everybody's education and safety, the guidelines that are being disseminated in public are guidelines that are used for healthy white men. If you don't fall into that category, you need to then determine, okay, what is best. You can't say that the CDC says, oh, well, they said we can do indoor events. We don't have to wear masks. If you've been vaccinated, no. If you are Black, that's not the case. If you are Hispanic, that is not the case. If you have a pre-existing or what's the official term? Comorbidities. If you have a comorbidities or pre-existing condition, there's a whole separate guidance for those as well. So just make sure that you are educating yourself and not taking what's being publicized as guidelines. I'm not saying that the guidelines are incorrect, but you have to understand the subset and the context of who those guidelines are for. Absolutely. And then oftentimes they don't include us.
Absolutely. You're right about that. I want to go back to something you said as well. And Jerry, you jump in here. That test to treat within the 5 days. Mm-hmm. That's a game changer right there, because of the fact that kind of not eliminate, because you really can
eliminate.
No. Go into quarantine yourself.
Right.
But with the test to treat, they're going to give you the 5 pills. Now, Derek, the thing that bothers me, I read today where there are some people that these pills, the medication has adverse effect with some of the medication people are taking. Mm-hmm. So we want to make sure that people do not just take the pill just because I have COVID and they come in and they want to give me these 5 pills. I must kind of check to see if any of my medication will adversely affect with these pills. So y'all talk about that a little bit. I'm sure that's a concern.
It's definitely a concern with me, because all of us take some form of medicine, but if the pills has adverse effects with other medicine that we take, right, then we have to make sure that when we talk to the pharmacists, that we ask them, if we get the pill, ask them, how will it affect the medication, and make sure you know the medication that you are taking. How will it affect? How would that medication affect the pills that you get that you are supposed to be getting for the test to treat program? And so, we need to make sure that we ask those questions when we get there, because there is hardly a medicine on the planet that don't have some kind of side effect. Mm-hmm. And even if it don't affect you, it may affect somebody else. So it's wise for us to get an understanding of how these things affect us, so we can help others that may be taking the medicine or the pills that's by Moderna and Pfizer and all of those individuals, to make sure that we know exactly how it's going to adversely affect us, because we definitely don't want that to happen, because then the wrong information going to get out there.
Well, Derek, go ahead.
Yeah, I was just going to say, that's just good guidance that I think we should be practicing in our daily lives in general, irrespective of the pandemic. You always want to make sure that you review or, have or develop a relationship, if where possible, with your pharmacist, so that they can look at your overall list of medications and say, no, these two don't interact well with each other. And, in the same case, I'm not sure with the Paxlovid, I know it's a 5-day treatment. I don't I don't know that I know whether it's one pill a day or if it's a couple of pills that you have to take daily. I'm not sure of the dosage.
One pill a day.
But in any, you said it is a pill a day?
I think it's I don't
Yeah.
quote me.
I'm not 100% certain, but whatever the dosage is, you want to make sure that you, if you do test positive and you know that you are on current regimen of medications for whatever conditions you may already have, you just want to make sure that there's no adverse effects. I mean, like with respect to what you said, every medication has some type of side effect. It may not affect one person the same that it does another, but there's no medication that is currently manufactured that has zero side effects. That just does not exist. So with the go ahead.
What? No, go
I was
ahead.
going to say, with that, you just make sure it's just good guidance and good practice to go ahead and ask your pharmacist or your healthcare provider. But I think the best person that will be able to provide you the insight that you're looking for in terms of what medications don't interact well with each other would be your pharmacist.
Well, tell me this. If there is an adverse effect with your medication and the pill that they are administering, is there an option? Is it just one manufacturing that has the pills?
Right.
Or-
So right now it's just Pfizer who's doing Paxlovid. And that's a combination. Right now, it's a combination of two drugs that they manufacture. I always forget the second one. The first one is ritonavir. I don't recall the name of the second one. But right now, the only person that has the only pharmaceutical company that has an indication for the adverse effects is Pfizer with the use of, for the COVID at-home treatment. Oral treatment form is Pfizer. And if you wanted to, you can always go to Pfizer's website and they have a list, because every company, as it relates, every pharmaceutical company has a list of what all their side effects are. They're mandated through the HIPAA laws to have that detail made public and available. Now, they don't, what you do see, you think about it when you look at television shows and you see the advertisements online on TV for this drug, and it may cause fast heartbeats, may cause alopecia, may cause fill in the blank. So they do have those, and they make you publicly available for them. But for those treatments that are not advertised on television, you have to do a little bit more of your due diligence to find out what those side effects are.
But really, the average person, Derek, in our community, from the lower social economic area field, they will not research and find out. So I think that's what Stay Safe, Pensacola, and this show in dealing with COVID, Let's Talk COVID, need to let people know, let them be aware that there are side effects. So they're not going to go searching for them. But the reason why I brought it up, because I didn't think about it. I was so happy to see the test to treat, and that you can take a pill that I didn't think about. Well, suppose that pill has adverse effects with my medication. And when I saw that, I thought that's very something we need to bring up, and we need to talk about on every show, that's something that they need to do.
Okay, we want to make clear that we are talking about the pill and its adverse effect where it may have other medications. So we want to make sure that people understand that. Also, I see Bill Snow is watching the show. We wanted to welcome him home from the hospital. He was in, and I don't know if he want to talk about what took place, but if he do, he can come in and talk about it.
But we want to talk about, Derek will be back in a few minutes, but I want to talk to Jerry, and when Derek comes back in, and we're going to talk about the myocarditis in a few minutes. But I want to just hit on another thing that Derek said, was that the at-home test, they're changing the way they're going to distribute those at-home tests. My understanding is that you can still get it free through Medicare and Medicaid and your job insurance, it'll be free. But if you are not one of those three, you're not in those categories, then you'll have to pay for your at-home COVID test. And we're back to, I think, looking at the underprivileged, being more burdened by this than people that with money. So has that changed any?
So what, as my understanding, the folks who are leading that, I hate to say leading that charge, but the main proponents of those individuals has been Quest Diagnostics. With that, I don't necessarily understand, because I get that they're a part of the, they're a diagnostic. So like with any other pharmaceutical diagnostics company, this falls within their purview in terms of manufacturing. I don't know if they actually manufacture any of our current at-home COVID-19 test kits. I would think that they would be a little bit fiscally irresponsible if they didn't, as well as for the good of the United States and those communities in which they serve, to not make them. But I don't know that to be the case. But I don't know how, typically with the diagnostic companies, unless they're selling them directly to the consumer through a retail provider, there's no way for you to purchase it from them. So like whether I'll use like the blood assays where you test for certain blood disorders and traits and so on and so forth. Those are usually provided from your healthcare provider or from some type of medical company. So I don't know what the guidance is. I look at this as what they're saying is being no different than the current at-home test kits that are being sold at like CVS, at Walgreens, and things of that nature. So with that, I don't think that there is going to be I don't expect there to be an unnecessary burden to be placed over and above what those who are socioeconomically disadvantaged already incurred with that.
But I'm mainly talking about distribution of the at-home test. If I can get on there, if I'm on Medicaid care or Medicaid, I can go online and I can get my 8 free tests. Mm-hmm. If I have insurance from a company, from my understanding, you are eligible for free at-home tests.
Right.
If I don't fall in those categories, then I cannot obtain an at-home test from the government. If I'm hearing this right, is that correct?
Well, no, if you have not ordered your free test through the normal channel of COVID.gov, that is still accessible and available to you.
The two tests.
But the 2 kit, well, four tests in that 2-pack.
Yeah,
kit. So that you still have that is available to you now, above and before. So right now you have 2 opportunities for those who have not done it. I don't know, so I won't speak to say if you can order 8 now because you didn't order the 4, but I do know, I'm assuming they've adjusted it. So if you have not ordered any, you can order 8. And so you will have 8 kits, 8 tests that are made available to you at this point that are free of charge. Now that at least gives you 8. When we're talking about
that's for people with Medicare or Medicaid.
No. I'm talking about the ones that we did initially that took forever to get, and now the second order that they have. I'm talking about those. So not the free Medicare, Medicaid ones. I'm talking about the ones that are the 4 test kits that, if you recall, we talked about how long they took.
Yeah.
So those are still available for those who have not yet ordered their kits. That's separate and aside. So using the COVIDtest.gov, you've got 3 avenues that you can get test kits. 2 of those avenues are free. You've got the one that's been made available for all citizens where you could order the 4 test kits, and they extended it. They did a second round. So that's why I keep saying 8. You also have the second option that's free is the Medicare, Medicaid option for those who qualify where you can order the 8 test kits per month ongoing, effective today. So starting in April, which is today, you can order those 8 kits per month per household. So those are your 2 free options. And the third free option through the government is for privatized insurance reimbursement. If you don't have insurance, then right now you're looking at only having that first option as a free option, which is the 8 test kits that you can get, or the 2 sets of 4, rather, I should say, that they've rolled out through the government. Now, after that, that's where your question comes into play, whether or not they'll have to pay some additional funds for that. But I'm not sure where we stand on that right now.
Because the two kits, you know, it was 4 per month, really. So it's been administered twice. It rolled out twice.
Mm-hmm.
Do you know how long that's going to continue?
No, because right now we're on now week 4. They have not given any guidance about how long they're going to continue that practice. Because right now we're on week 4 of the second rollout of those test kits. Because the second round that we got, that people took advantage of ordering for free, that was only supposed to be for a week, and now we're on week 4 of that of those kits being made public and still available for you to order online. So they have not given an end date for it. If I had to put my best educated guess, I think it's going to be for as long as the government allows. They're going to coincide it with the insurance regulations. Right now, I don't, just separate and aside, you know, the federal government has mandated that insurance companies cannot drop people off their healthcare coverage at this point in time. And that's for as long as the U.S. government deems COVID to be a severe enough issue that is plaguing our community. So as long as we're in the pandemic, they'll do that. I would venture to say, I know that protection is going to extend through the end of this year. So I'm hoping that the federal government will have the free test kit administrations coincide with that at least through the end of the year, but I won't say that for certain.
One little question too. You know, there's Stay Safe Pensacola is a group of individuals sponsored by the city of Pensacola and other collaborative partners, where we give out free at-home test kits. We do it once a month and we go to different locations. Now, this is a way to get some free at-home tests because of the fact that it's important for you to know that if you have COVID, instead of quarantine, you can go and get tested. And again, we're telling you, if you do go and get tested and they give you a pill, to kind of see if it has adverse effects on it. Mm-hmm. But also to make sure that any of the tests that are available out here that's free, you need to get your hands on them, and you might not need them now, but you might need them later. Mm-hmm. So we're saying this is an opportunity to find out where you can obtain free tests, and also to begin to understand the importance of having them. Don't say, a lot of people say, oh, I don't want them, I don't need them right now, but COVID is not over. Jerry?
I'm just going to say, for those who may have started watching the show late, we're talking about test to treat and the pills and how it may have adverse effect with some of the medication that you may be taking. So we are advising people to ask their pharmacist when they get the pill, if they're going to take the pill, to ask them what kind of medication is that may be adversely affected by the pills that they may have to take for COVID, or they will be taking for COVID. Mm-hmm. So we wanted to make sure that people understood that. Mm-hmm. But it's incumbent upon us to continue to get the vaccine. Mm-hmm. I would hope, because we know that is working, it have saved over 6 billion lives around the world. So, and over 6 billion have been in at least vaccinated with one shot, at least 1 to 2 shots at least. So we know that worked, but we are not totally sure about the pill and how it worked with other medication. And that's what we are stressing. Be sure to ask your pharmacist or let them know what kind of medication you take if you have to do the test to treat at the pharmacy at that particular time.
And I want to make sure that the viewing public is not misinterpreting what we're saying about the adverse effects. Well, be clear, and I want to reiterate: adverse effects or adverse incidents, as they're called in the pharmaceutical industry, only occur in a very small segment of the population.
Exactly.
The likelihood that anyone will experience an adverse incident as it relates to the oral administration of Paxlovid is very far and few between. But it would be socially irresponsible to say that there are no adverse effects and you won't have any. But I don't want us to, I don't want anybody to misconstrue us highlighting that there have been identified adverse effects amongst with individuals who take certain prescription medications. With you take that and all of a sudden you'll hear people, you take that pill, your leg gonna fall off. And I want to make sure that we're, that nobody is taking that to say, okay, don't take that, or they say it's not safe. No, we're not saying that at all. It is completely 100% safe to take it. You just have to be cognizant if you are an individual who takes already prescription medications. I'm not even going to tell you what those are because I don't know what they are. I don't know if it's high blood pressure medication.
Right, if you want to know
what it is. So I can't say avoid it if you take metoprolol or avoid it if you take this. I'm not saying that. I'm just saying ask your pharmacist at wherever you get your prescriptions filled will best be able to tell you if any of the medications that you are currently prescribed and taking have a negative interaction with this oral form of treatment, should you have to take it.
Right, and we're talking about adverse effects. Aspirin, grapefruit juice. You can't mix that with certain medication.
Right.
Like we're saying, we're not saying that there's a problem with it and use it as a negative. We're trying to let you know that this to be aware. It's more of awareness and more so than this is something that's bad. No, it's a good thing. I really think it's a good thing. But then we still have to bring about awareness to the community. Now, I do want to talk about. I'm gonna move on to myocarditis. Are you familiar with that? That's is an inflammation of the heart muscle, and so what happens with that is that after the second Moderna or Pfizer shot or vaccine, then there's a chance that people can what can I say? Get that myocarditis, and in fact, we know someone that did, but no one has ever talked about that too much. I think we need to bring about awareness as to what can happen. Now, Pfizer and Moderna, they're changing the extension. If I'm not Derek, they're extending it from 4 weeks because I think Pfizer was 28 days. And at the beginning between the vaccine 1 and vaccine 2, and Moderna was a month, 30 days between vaccine 1 and vaccine 2. Now they're extending it 8 weeks because of the myocarditis that can happen, the inflammation of the heart.
Heart muscles, yeah.
Of the heart muscle,
It's though rare the Moderna and Pfizer vaccine have been associated with elevated risk of myocarditis. However, even among the highest risk group, teenage boys, the risk of cardiac condition was higher after COVID infection than the vaccine. Letting you know, even if you got the COVID, it's much higher.
Mhm.
And they're saying this for the people that get it is low in every 100,000 or so people. So that means it's not as dangerous as not getting the vaccine as it is. I mean, you are not as safe if you don't get the vaccine. Because if you get COVID, there's possibility that you're gonna get this myocarditis.
No.
I will say though that condition is the risk of myocarditis is exacerbated by people who already suffer from cardiac issues. And since, like, I'll tell you, for example, I use myself because I know me. And you all know as well. I suffer from heart failure. I've had it for quite a long time now. And there was a point at which, if you recall, way back when Chet's is open, getting to a personal thing, I used to wear this. It's a wearable defibrillator. Some of our viewing public may know. It was, I forget the name of the thing it's called, but I used to wear a wearable defibrillator, and it had this big, all these wires came out of the side of my shirt with this big box. And people used to think, for whatever reason, I had a bomb attached going to sit down for dinner. But nonetheless, I am one of those individuals that run a higher risk of having an acute onset experience with myocarditis. I've been monitored. I'm fine. And when I say that to say, even in my worst condition, in my worst experience of the condition, am still okay. So, when we highlight these issues, I know it's a matter of better be safe than sorry. So they are extending the length of duration in between doses. But if I want to make sure that, I don't want anybody to take any opportunity to say, oh no, I don't want the vaccine because my heart might explode, or
Right.
my heart might not pump right.
But I don't want anyone to also hear us talking about it, and then hear us promoting it, and then something happens. And
right.
and they'll say, well, they didn't tell us anything about this, or I didn't know it, and I've watched that show, Let's Talk COVID, every Friday, and I didn't hear anything. We have to let them, and I know you want to be cautious about how it's presented, which is right, but we still have to let them know that so when they get it, it's not like, okay, it's on them. They made me take it or whatever. I want everybody to be honest, and you find out for yourself. We're just giving you different information, awareness, and then you research it yourself, and you make the decision yourself whether or not you're going to get vaccinated or get your booster or not. You make that decision. We're just giving you the information, providing awareness and empowerment.
Yeah, and I completely agree with sharing the information at that. My comment is more geared towards people who will take that and say, oh no, well, they said it's gonna make my heart explode.
Yeah,
that's not.
You can have the naysayers all the time. We cannot worry about the naysayers. We just have to go on and keep moving forward and do what we have to do. So, we can't worry about what the naysayers say. Right. But we do have to, it's our responsibility to make people aware of the pros and the cons.
Yeah, so they can make an informed
decision. And then
decision.
they make the informed decision.
In case they do have something, some kind of pressure on their chest, and they might, like you say, some people have it already, have heart conditions already, and if this come about, they need to know that, go check yourself quickly. With anything that gonna put pressure on your heart, you need to go quickly anyway. But make sure you go and have yourself checked out, because this is what inflammatory. But at the same time, we don't want people to not take the vaccine
Because it's better to take the vaccine than not take
the
the
next cost.
vaccine.
If you get COVID and you get it, it's a possibility that it could, end your life.
Now let's move on to have you heard of this hybrid immunity? Hybrid immunity. Have you heard of that, Derek?
I'm not familiar with it.
I found this out. When you're doing research on something, you find out some interesting things.
Mhm.
And so hybrid immunity is having both been fully vaccinated and previously infected with COVID-19. So you were vaccinated and you were infected with COVID vaccine at some point. So they're calling those people hybrid immunity, and they're saying they're more protected against the upcoming viruses than anyone else.
Mhm.
Mainly because they're vaccinated and they've had the COVID already. Some people think that they've had the COVID, that they are immune to catch. I can't catch again because I have antibodies and I'm immune to getting the COVID again. So just giving out some of the terminology again, so people, if they hear it, they'll kind of say, yeah, I heard about that. And again, research it on your own. But I thought I had never heard of hybrid immunity.
Yeah, I didn't know there was a term for it. I don't even know, that's a struggle because I think about, I won't tell because I know I'll get chewed out if I put people's stuff out there. But I know people who have gotten their both shot, well, in order of succession, had COVID, gotten their shot, their vaccination, gotten their boosters, and still contracted COVID a second time. So, I'd be curious to see what the studies show about, them being a little bit more immune. So I would think, I would hope if that was the case, then you would see less risk as it relates to catching COVID a second time if you've already had it and you've been fully vaccinated and boosted. But that doesn't seem to be the case. So I'm curious about those studies and see if they make them if it becomes a more prevalent topic of conversation in the community.
Right. It was just put out Friday. So this is something new. But be aware of that word. You might hear it a little bit more.
Let me just read this. T.D. Taylor said, just like any medication, there are risks involved. Every prescription comes with a disclaimer, even aspirin. People should talk to their doctors, especially anyone with a medical condition, which is good advice.
Yes. But most of the time, if you go to the pharmacist now, because they say you can go to CVS or you can go to Walmart with your positive COVID, or Walgreens, with your COVID at-home test in your hand, or you're saying I don't feel well, and you test COVID there, they're going to immediately want to prescribe the pills. And so you then have to say, I'm going to take it, but first I want to see blah, 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 become aware of how the pills will affect you first. That's all we're saying.
Well, the good thing is if you test positive and you go into your Walgreens and your CVS and your Rite Aids and Dwayne Reed's or whatever the case may be, hopefully you're in a position, I'm hoping that you are going to, I'm hoping that you're choosing those locations because that's also your pharmacy. And you're in a better position to talk to your pharmacist at that set time to say which one of these medications, if any, interact with the use of the Paxlovid. But with whether it's the drug interactions or as it relates to you individually and your physical ability to be vaccinated, I think you said Taylor is correct. The best person to have that conversation with is your primary care physician.
But yeah, and if they go to them to test, but if they go to the pharmacist, if you go to Walgreens or CVS, then they do have a person on site that, if you get any new kind of medication, that said, do you want to talk to the pharmacist? And you step over to the next window and someone will tell you if that has adverse effects with your medicine. there's a negotiation to approve a $10 billion COVID relief. Is an addition to what Biden has now. COVID relief plan. What do you think about that? What's going to be in that? Will that include, his new plan that we talked about all the time? Will that cover that particular next step plan? Is that what he's trying to do?
Yes, and if you recall, you asked the question several weeks ago whether or not the 30 billion was enough, and now we're saying no, it's not. So this is a way of going back to make some additional relief. It also does, to your point, cover his additional next steps that we've talked about, and making sure that we're as adequately prepared. It also also includes funding so that we can focus on the prevention aspects as it relates to our African and South American countries. Because again, as we've talked in the past, unless we get a handle on reducing the spread of COVID-19 in all of its forms in South America as well as the continent of Africa, we're never going to be able to come to a point where we can get established herd immunity in the United States or anywhere else in the world, and so certainly in the Western Hemisphere. So that the additional funding is going to be inclusive of the prevention programs and the rollouts for the vaccines as it relates to getting them to those countries as well.
I was looking at we talked about in Hong Kong and in Shanghai, they expanded COVID lockdown. So life is on hold for 26 million people over there because COVID came back. Well, and many people didn't get the vaccine, and so now and then, like always, people go back out too early. And it begins to come back with a vengeance. And I'm concerned about that BA.2 because now it's the primary variants in the country. And they're saying it's 30 to 80 times more infectious than even Omicron. So, that in itself is scary. But and they are looking for the second, this fifth wave to come up around this month, as a matter of fact, where death follows it. Once you get that hospitalization.
Right. They're saying this month. That's why they're offering the booster. They're offering that booster. As of now, as of today, you can get your fourth shot. Or vaccine or booster, whatever. It's the first vaccine, second vaccine, first booster, second booster. Now we're on the second booster. You can get that second booster if you want. And we talked about that on the last show because I think that you can now, what I was saying about extending it a little bit. I still think it's been a while. I've got to look at my card to see how long it's been since I've had that that first booster. And then, but because I know that they're saying also that during the fall and when we're going back into the homes, that they're expecting something to shoot off then. So just kind of everybody should just be watching and staying safe and take the vaccine, take your booster. I know I'm saying that I'm waiting a little bit, but I am going to take it. And that's not without question because I do not want to catch anything. I've gone this long and I want to continue it. Don't want to let my guards down.
And I was going to say, if you're entertaining, try not to entertain indoors. At least try to entertain outside where there's space and you're not on the inside where this thing can hover. And even at that, when you're outside, it's distant as much as you possibly can.
Right, and there's adequate air circulation. I wanted to say I was, when I saw the news reports about Shanghai, I was actually surprised that we saw them having to go back to another shutdown. Because as someone in my past life, I used to travel to Shanghai on a monthly basis for a total of 8 years. And, they've been wearing masks and doing all the stuff that we've been doing forever. I remember the first time I went, I used to be like, why is everybody wearing a mask? Like that's a big, and so to see like they practice their what we now know as social distancing, they've been doing this for years, and
Yeah.
yeah, to see that they've had a recent uptake in their COVID-19 numbers says something. So if a country that has been doing what we call social distancing and COVID-19 protocols since at least I know I can remember since 2003. I'm sure they did it before then. That was my first experience. To see them still have a continuation on the uptake, that says a lot. It's very predicting for where we are as a nation as well. So
Yeah, that's something we need to really, to me, that lockdown, a second lockdown, or however, and they've been wearing masks. That's kind of scary. We need to watch that closely. I'm sure United States is. What I see is that something tells me if they still are passing out N95 masks. I went into CVS yesterday, Derek. And so they announced over this system, they said, if you want your 3 masks, you can go to any counter and get 3 masks. I said, okay, let me just get the 3 masks. They're free. And so I went up to the counter, Derek, and she said, let me look over here. She had a whole box, a box full of them. She gave me a whole slew of them. It was like, hey, you can take them because nobody else is picking them up, and I don't want them here at CVS, so they're not worth any value. So take them here, take them. I was so surprised.
Yeah, which CVS did you go to?
Kingsford. Well, I'd rather not say.
Okay. Now, I will say that I went to Winn-Dixie on Bayou, and they're giving out a 20 pack of KN95s. When I went, they're at the pharmacy, and I said it now. Everybody, when I go back to get some more, they're gonna be all gone.
Looking for you.
Look at this. That Derek Scott said that. No,
Right. But the one that Winn-Dixie on Bayou, when I walked out there, I was like, I went and I said 1, 2, 3, 4, because they were already prepackaged. Like instead of the 3-pack, they just were stacked, and I was like, how many masks are in here? And I did the little thing. It was 20 of them in there. I said, and to your point, the lady at the pharmacist, I was like, because I was unclear because there were a lot in the package, but they had like 4 or 5 packages sitting up there, and I was like, well, are they gonna take out 3 and give it to me, or what? I didn't know what their policy was. And the lady, asked the lady, I said, well, I'm curious. I wanted to make sure you had the mask available. She was like, take them. And to your point, she gave me the whole thing. I was like, oh, okay, well, thank you.
But you'll realize that later on, if it does come back, then you're gonna be looking for those same masks that you walk past, the same at-home test that you did not take. You're gonna wish you had them available. So we're asking everyone to please go get your N95 mask, put them to the side, go get your at-home test, and go get vaccinated, get your booster shot, and be prepared.
Yeah, I go through I use the Scan and Go app at Walmart as a Walmart Plus subscriber. So when I go in, I don't have to stand in the lines. I just go and put my phone up to the screen and then just bag my groceries. And as I'm doing so, I'm always amazed because they have, how they have the greeters when you welcome to Walmart. The ones by me have the greeters, and they're like, would you like your mask? Would you like free mask? Everybody who walks in the store, and this is not indicative of any culture, it's everybody.
Everyone.
Everybody that you see, when you can see their whole face, those are the people who say, no thanks, no thanks. So that's all you see is a whole bunch of no thanks. And I know those people are like tired. I'm like, can I have that? Since you didn't give them, since they didn't take them, I'll take them. And so I just feel like they're still in plenty, but that it's good to know that you can get them, but it's sad because we still have people who operate. Like I hear people say, oh no, after COVID. Well, I missed that letter. When did we get to after COVID? Like COVID is still here. COVID's still rampant. What are you talking about after COVID? Do you mean post-vaccination? Is that what you're saying? But, it's still just to see, I'm still surprised at the amount of faces that I can now see going into public that I've seen in the last 2 years. It's just like nobody seems to wear a face. Nobody seems to wear a mask. I always I feel like I'm the odd man out. I'm like, well, y'all, I'm good. I
I'm
made
good. I don't-
yeah, I don't, because I'm like, I made it this far, COVID free. Now, God willing, I will continue to make it, throughout the duration COVID free.
Right, right.
Well,
Walk around and they're chatting like, hey, they're all in each other's face and hugging. I'm like, y'all crazy. But
let me say this, Derek. Overseas in places, especially over in Asia and different places over there, they wear masks, especially in the wintertime, because flu, colds, and all that. They wear those to keep from giving it to everybody else, and the virus is very low when you do that. When you during the winter months. Well, here nobody wear a mask, because that's why we catch flu so much, the common cold so much, because we are all spreading germs back and forth. And I feel sorry for teachers in the classroom, because one child come in, they gonna spread it to everybody else. It's not as it's not a death sentence in most cases when somebody, but it can turn to pneumonia. It can turn to other things. You could cause respiratory problems in the long run. And so the thing about it, if we were doing like they were doing over there, we would have less people catching the common cold and the flus and all of that. We wouldn't need all of the medication that we have to have, and the missed flu shots. You get a flu shot, it might be for the wrong virus and all of that. So they do it to protect themselves and to protect their country and protect others as well.
right.
Look, we've got about 2 minutes, but let's briefly talk about the allergies. There's some people, I know you've heard too, well, they cough or they're running nose or something, and they say, this is my allergy. And this is allergy season. Maybe on the next show, we can talk about allergies and COVID, because they're so intertwined, and you've got to make sure that when you say it's your allergy, is really your allergy and not COVID, and vice versa. And so that's
why that mask could come in, because if you're allergy prone, if you're wearing that mask, you're less likely to get those allergies out there. But that's another show. Just want to thank again our sponsors: Stay Safe Pensacola, Movement for Change, the City of Pensacola, in collaboration with the Health Department, all our partners, WBQP TV, which 12.1, which is the show is being shown on right now. We want to thank 980 AM, WRNE 980 AM, and Choice 106 FM, Karen Hart of Pensacola with Fannie Finkley, all of those people that are collaborating with us. We want to thank Derek with the task force, White House Task Force, for hanging out with us and becoming a host with us.
Yes.
Also, he's with the Black Caucus. So we want to thank him, and we want to thank Vernon Watson for always being with us, showing the show every Friday with WBQP TV, and also his YouTube Fire Stick. Be sure to go to his YouTube channel and subscribe, and go to ours as well and subscribe. But you can catch us on Fire Stick, YouTube, and Roku channel.
We have 1 minute, Derek. Do you have any last words? You want to shout out something? Or
No, I just want to say, if anybody has questions, I know you see our names and whatnot. If you have questions around COVID, you need assistance or on identifying resources, please reach out either to either one of the McIntoshes, myself. I'm on Facebook. I think my page is public, but Derek Scott. It looks like, well, somewhat looks like me, but I have on a hat. So if you look for my picture, you should be able to find me. If you have questions, or you can reach me through political platforms. If you need to have if you have questions around those, I'm out, I'm about, well, let me rephrase that. I'm accessible. I'm not out and about, but I'm accessible for those if you have questions. If you need help, I'm happy to do so.
Also, in saying that, you can also contact Dr. Isaac
Isaac
Williams.
Williams,
You can
yeah.
also contact Nicole Dixon, who is the co-director of Stay Safe Pensacola. Those are people that you can contact around here or ask anyone about Stay Safe Pensacola. They will get in touch with us and we'll be able to either put it on the show, answer your question. We'll find out, we'll research. If you have a question, let us know and we'll research it and we'll have it on the show.
And if you think it's something that we should be talking about on Friday or Sundays, on Sundays on Our Voices of Community Conversation, just hit us up and let us know.
All right, with that, Derek,
Derek,
we're gonna see you Sunday.
Mhm.
And so we're gonna say good night and have a great weekend, Derek.
You as
Good
well.
night.
Good night, everyone.
Bye. Good night.